interesting episode of Let's Talk. You don't want to miss this. Today, we're at Cedar Care. We'll be talking to Dr. Kalu, the medical director at Cedar Care.
So I'm a consultant psychiatrist. My training was done in the UK, and I've worked as a consultant for several years. In that part of my work, again, I see women, I see children, I see adults, but there it's very specialized work. So I tend to see people who other general practitioners refer to me.
Okay.
So people go to see general practitioners, they say they have mental health issue, right. And the general practitioner then refers to me. Okay. And I see them. I usually run my clinic on Fridays. Occasionally I do home visits where I go see people who, because of their mental health issues, they cannot come to the hospital, so I have to go and see them at home. Okay. I enjoy that part of my work very much. It's very interesting and very makes when people get better from mental disorder, it's such a rewarding experience.
And the most interesting part of your work, which is the mental health aspect of it. We'd love for you to shed light on it in different, diverse ways. First of all, describe what it is and the signs, or what are you looking for before you say somebody has, or is mental, or has rather a mental health challenge.
Okay. I like the way you put that, mental health challenge. I am always advocating that we shouldn't sugarcoat mental illness. People don't sugarcoat physical illness. People have headache, or they have malaria, or they have fracture. They just say it as it is. But mental illness, there's always this temptation to try and present it in a way that is acceptable. And because of that, I think for some people it even increases stigma associated with mental illness. Right. Back to your question, how do we recognize mental illness? Mental illness is slightly different from physical illness in that the people who suffer from mental illness, sometimes it is not obvious to others around them. If you have a fracture and you have a pupil in your hand, everybody knows you have a fracture. Right. If you are shivering from cold and fever, anybody who sees you knows this man is not feeling well. Fortunately, with mental illness, it's not always that way. Okay. Sometimes it is not obvious. At other times, it is plain obvious to other people that something's wrong. And therefore, specialized skill is required to be able to tease out when somebody does have a mental illness or when they don't. Okay. Generally, for purposes of educating the public, we would share certain things as things to look out for. Right. But that is not to say that when those things are absent, mental illness is also absent. Right. It may still be there. Wow. So the commonest feature that most people feel for most people who have mental illness will be a disturbance in their usual routine. Okay. And that will include things like sleep, inability to sleep for many days on. Some people can go for 2 weeks without sleeping. But when I say disturbance in daily routine, things like eating gets disturbed. Some people find out that they don't feel like eating at all. They go for hours of days without eating. They're not doing a spiritual fast, but just don't have an appetite. For some people, a disruption in their self-care. Not make the woman who normally make up usually not make up or not care about whether they're properly dressed, whether they are groomed themselves or not. So just neglecting themselves essentially can be a sign that something is not right. Someone may have a mental illness. The other things that people tend to notice is that someone who is not performing as well as they used to, whether it's at work or school, and sometimes even relationships, the way we tell mental illness is creeping is when a relationship that used to work really well between husband and wife or mother and child, it's no longer as good as it used to be. And all of that could be indication that maybe mental illness is still
underlying.
Underlying needs to be addressed. And then the ones that are obvious to everyone is people who become violent without any cause for it. We see people who take off their clothes, people start to talk, they make irrational statements, bizarre behavior. Somebody goes to the dump site and starts eating from the dump site, or take off their clothes and walk around naked in the streets. Those are obvious signs of but it doesn't. The obvious symptoms or signs tend to show towards the end or towards the latter part of the illness rather than at very early on.
If not being treated.
If not treated, if not treated. The good thing is that a lot of mental illness can be treated if caught on time. The prognosis means the cause or the possibility of improvement is much higher. The sooner you treat, the better.
Okay, so the last time we spoke, you did say something about patients that come here, how you can detect, how you're trained, your staff are trained to see, yes, you're speaking about or checking the physical ailments, but then you're also looking for telltale signs. Could you elaborate on that?
So because I'm the medical director here, usually the head of organization would influence an organization and have an influence over the culture of the organization. So I'm conscious that everybody who works here is psychologically minded. What that means is that everybody should be thinking about what is going on in people's lives and in their minds rather than just what they see in front of them. So if a patient comes to see one of my doctors, one of our medical officers, and he's saying that they have headache and they have fever, or they can't breathe very well, the doctor shouldn't just think about asthma as the only reason why this patient can't breathe very well. There's something called panic attack, anxiety that can affect people's breathing. So the doctors here know to ask, is there anything else going on in your life that's making you anxious? What else could be responsible for this difficulty in breathing, or other than just asthma or a respiratory problem? And it's not just the doctors, even for the nurses. We encourage our nurses to not just come to a bedside, see a patient on admission and just give them medication and walk away. We encourage asking, yes, engage, find out how they're doing. If they look unhappy, is it just because they're unwell? Is there something else going on in their life? So our nurses are more than social workers. They are not just nurses, they are also interested in what's going on in people's lives, and they our training and our culture here is to ask questions and to support, and if necessary. I mean, we've had situations where people have come in to be treated for a physical condition, maybe they've had surgery, but in the course of talking with our nurses, we've realized that there's domestic violence going on at home, and in that process we've been able to give advice, guidance, counseling, and supported the woman who is here, not because of the violence, but because she's opened up to a nurse who's able to direct her.
From there, we're going to delve straight into anxiety, because you mentioned anxiety. One of the things we would like to know is what causes depression and anxiety, and what do you look out for? What causes it, or causes of it, so that you stop or you're not prone to this again? And as parents, especially, what do we look out for as signs of anxiety and depression in the children?
Anxiety and depression are two different things. They're two different disorders. Sometimes they can coexist in the same person. With anxiety disorder, the things that we generally look out for, we things like a child being scared to go to school, there's school anxiety because that child is getting bullied in school, or she's worried about performance in schoolwork. Sometimes anxiety occurs in children as a result of difficulties going on at home. If there's a lot of conflicts between the parents, that can cause anxiety in the children, because the child is worried that his or her parents are going to be separating very soon and get divorced. And because they don't want that, they fear that this is going to happen. Because that's essentially what anxiety is. Anxiety is fear and worry about something that hasn't happened, that unreasonably worried about. Because there are no two couples who don't have conflict, but the conflicts become continuous all the time.
It affects the child.
The children start to get worried, and that can be a cause for anxiety. And there are other things. Children who are worried about illness and ill, there's something wrong with them. Every child goes through their growing up years, will have periods when they're anxious, but that itself is not really a problem. Going to a new school causes anxiety, changing home environment causes anxiety. My kids were very anxious when we were coming back from the UK to Nigeria. But usually, we're all designed to cope with a little bit of anxiety and deal with it. The problem is usually when that anxiety is prolonged, it's consistent, it's not getting, it becomes a disorder. Why with depression, which is slightly different, is when a child suffers from very low moods, which is persistent. Usually, as doctors would say, that low mood will have to be there for at least 4 weeks. Usually associated with other symptoms, not eating, not sleeping, being tired all the time, not being able to concentrate or do any kind of work, not enjoying the usual things the child will enjoy, whether it's watching television or playing sports, not being able to engage in the things that the child would engage with, because they're just wanting to be left alone, locked in a dark room, not wanting to talk to anybody.
Wow.
That's I think that's depression that needs to be treated. And if not treated, can lead to the child now thinking nobody wants me and nobody enough.
And then becomes suicidal.
Comes to start have suicidal thoughts, and then we've had children who have killed themselves or start to cut themselves as a result of untreated anxiety or depression.
What causes it?
There's that cause you can find of physical illness. With anxiety and depression, what's been found out scientifically is that when people who have anxiety and depression, they tend to lack a certain chemical in the brain. It's called serotonin. So there's a kind of a chemical imbalance that is present. However, that in itself alone does not explain everything. So we think it's a contribution of many factors.
Okay.
So there's that chemical imbalance I'm talking about. There's also the fact that the environment where you are in, what are you exposed to? Like I mentioned, for example, being exposed to parents who are in conflict all the time can predispose a child to
whatever's going on.
Yes, a child who's been bullied, somebody who's been sexually abused or even physically abused. These are contributing factors that can lead to anxiety or depression. And then there's also this familiar risk factor. So a child whose parents have anxiety or depression has a higher risk of suffering from anxiety and depression than a child whose parents are not. And that's common for most mental illnesses.
So it doesn't just get passed on by association?
So it's not that it gets passed on by association. Well, that may be a contributing factor, but it's more about our genetic makeup, which we get from our parents.
Okay.
It doesn't mean that we would, and it's common with chronic diseases as well, like diabetes or hypertension. If one's parents have diabetes or hypertension, there's a higher risk that one's children will have it, but it doesn't mean that they will definitely have it. Of course, if one's parents have diabetes and then one does not eat properly or doesn't manage their diet very well, then their chances is even higher. But if there's a risk factor like a parent having depression or anxiety, means that you as a child, you are fortunate not to be exposed to other risk factors like bullying or abuse, and then your chances of getting depression is much reduced.
Okay.
I always describe treatment as a journey in mental illness. It's never a see the psychiatrist, get medication, and it's over. No, it's never that way. It can be that way with malaria, it can be that way with the fracture, because once you put your BOP, bone heals, that's the end of treatment. You may never be a fracture for the rest of your life. But with mental illness, it's a journey to recovery. And it's a journey that requires the therapist, that's myself, the patient, and loved ones who would support that person through that journey. Because from time to time, you would have blips or bumps along the road. You need those people around you to say, it's okay, we're heading the right direction. So if the patient comes in, we'll have the talk first of all. Again, because of our culture, I always have to explain to patients that it's important to be honest and to be transparent about our discussions and assessments in order to be able to help them. We want to find out what the predisposing factors are that led to this problem, what has contributed to it. Treatment is available. Treatment comes in the form of self-help. So I give advice to my patients what to do to help them get better, so they help themselves. Some, I can invite them to join a group therapy. That's also helpful. We also give medication. There's medication available for most mental illnesses. And then there's therapy, what we call psychotherapy. There are various forms of it. Most of it involves talking. The commonest one we use is what's called cognitive behavioral therapy, where we teach people how to change their thinking. By changing their thinking, change their behavior. So that's called CBT, cognitive behavioral therapy. There's also individual psychotherapy, supportive psychotherapy, where we talk about issues, trying to analyze them, trying to look for reasons behind behaviors, and try and most of this is the therapist just supporting the patient to come to terms with some decisions they've made and help them if they need to change a decision, help them change a decision. We never tell patients what to do. It's always a discussion and an engagement, and the patient will make the decision. In some cases, we do what's called family therapy, where especially where children are involved, and we know that the child's situation is as a result of the issues in the home environment, the family is affecting the child. And we also do couple therapy, where I see patients who is depressed, and I know that one of the contributing factors will be because of the marital relationship. We can do couple therapy as well. So various treatment strategies depending on what the aim of treatment is, what suits the patient at the time.
Well, so I just heard
medication is just a very small part of
it. Okay, but so I just heard what you said now. CBT.
Cognitive behavioral therapy.
So that's I'll just go ahead and prescribe that for everybody. Like, we all need a bit of CBT in our lives. But then you say something, and you say that you don't tell them what to do, that they make the decisions. Isn't that the reason why we come here in the first place, so that you tell us what to do?
Not really. As much as I don't tell you what to do, I give you the options. What we found out over the years, research found out that if patients choose, if you give patients choice, then they are more likely to adhere to the treatment plan than if you tell them what to do.
Okay, so the choices you're giving them are choices that are going to make them get better.
Yes, exactly.
Okay. So thank you, Dr. Olua, for your time. I remember coming and I asked you whether it's Olua or Olua. You said anyone would do. Okay, so thank you, Dr. Kalu. It has been such an honor, really, having you and your wife spend time with us and talk with us and talk with all of us. Thank you for your advice. Thank you for opening up. Thank you for your honesty. Thank you for Cedar Care. So guys, this is it has been an awesome time with Dr. Kalu Olua, and yes, the MD of Cedar Care here in Ogombo. So you can come in. It's affordable. It's loving. It's a beautiful environment. As you can see, we are in the hospital. Yes, you might think we're in one executive, hotel lodging somewhere, but no, this is the hospital, right? And we're here. We're live. And this is the medical director. Stay tuned for more interesting discussions. And thank you. Peace out.